Okay, so let's stream. So, okay, now we have started and the connection is good. So let's talk about today's objective. So today I'm going to study urinary symptoms and investigation. Basically, we are going to study about genitourinary portion of surgery from the book Bailey and Lobb Short Practice of Surgery 27th edition. So let's begin without any delay. There are many chapters in this topic, genitourinary portion of surgery, and those are urinary symptoms and investigations, kidney and ureters, the urinary bladder, the prostate and the seminal vesicles, the urethra and penis, testis and scrotum, and the gynecological portions. These gynecological portions are not that important, I guess. It is important, but we'll be covering much more of it in gynae and obs. So the rest are very important. For an instance, kidneys and ureters, the urinary bladders, the prostate and seminal vesicles are very important topic. So let's go to the topic, urinary symptoms and investigations. So learning objectives: to understand the significance of pain relating to the urinary tract pathology. Okay, significance of pain related to the urinary tract. Okay, to understand the difference between renal pain and the uteric coli. Okay, this is very important. Difference between renal pain and uteric coli, one of the most important topic in this chapter. To understand the definition of common lower urinary tract symptoms. What are symptoms of common lower urinary tract symptoms? Okay, to be able to select the appropriate diagnostic test to establish a diagnosis of urinary tract disease. So we are not going to go much more detail in about this thing, but others we need to. So I will be talking about these three objectives. I'll be starting from this chapter. Okay, so without any delay, let's begin. So at first there is something called as pain. Okay, pain is a common urological symptoms and can be due to the pathology in any of the component part of the urinary tract. Pain passing urine is called dysuria. Okay, and refers to the discomfort localized to the localized to the outlet of the bladder, which is experienced during voiding. Typically described as a sensation akin to passing razor blades or glass. Oh my god, razor blades or glass. Okay, most commonly dysuria is due to an infection in the lower urinary tract infections, but can be a symptoms of more serious pathologies such as bladder cancer. Okay, and carcinoma in situ of the bladder. So burning mutilation can be seen most commonly in urinary tract infection, but it is also most commonly seen in case of carcinoma in situ and bladder cancer. So in case of bladder cancer and the carcinoma in situ, burning mutilation are seen as well. So renal pain is usually caused by distension of renal capsule and is felt as constant gnawing pain in the loin. Okay, renal angle. So I just forgot about renal angle. Where does it lie? Okay. So renal pain is usually caused by distension of the renal capsule and is felt as a constant gnawing pain in the loin. So I was just checking my voice. It is good. So I just forgot to mention that at 40 minutes I'll be taking 5 minutes break. So I'm following Pomodoro technique. And that's what we do in Pomodoro technique. so we were what in renal pain. Okay, renal pain is usually caused by distance of the renal capsule. Okay, and if you're at constant gnawing pain in the loin. Okay, there is constant gnawing pain in the loin. Uteric uteric colic, often incorrectly referred to as renal colic, okay, is different from the renal pain and is typified by the, okay, there is difference between uteric colic and the renal pain, incorrectly referred to as a renal colic. Uteric colic, often incorrectly referred to as a renal colic, is different from the renal pain and is typified by the lateralized colic pain experienced by someone who has a uteric calculus. So uteric calculus might be, so I'm going to search about uteric calculus, just a minute. Uteric calculus. Okay, uteric calculus is basically a uteric stone. I knew that, but I was a bit confused. So this is okay. So the uteric colic is seen in case of uteric stone, and it is different from the renal pain. And in uteric colic, there is typical colic pain, and colic pain is little bit different from the other visceral pain, because visceral pain are generally dull in nature. However, the colic pain is reaches peak at certain point of time, and again it disappears. Colic pain is like that, and the colic pain mostly occurs in case of hollow tubes, such as ureters, gallbladders, okay, the lumens of intestines. So in those structures there is experience of colic pain, and uteric colic can radiate to the groin or lower. So radiation of a uteric colic can radiate to the groin or lower, still on the testicle labrum, but does not radiate to the back of the leg. Okay, if if there is stone in the ureter, it can radiate to the, if there is stone in the ureter, it can radiate to the back of the, it can radiate to the testicles, to the groin region, but not to the back of the leg. I don't know what is the significance of mentioning the back of the leg. Now, uteric colic can be caused by something other than a stone in ureter, such as blood clot or, okay, so we are talking about the causes of the uteric colic. Blood clot or really a sloped renal papillae. Okay, if the history is carefully taken, it will be apparent that some patients simultaneously experience both uteric colic and renal pain. Okay, so some patients have both uteric colic and the renal pain. Disease process in the bladder. Disease processes in the bladder. Example: infection of inflammation can produce suprapubic pain. Infection of inflammation can produce suprapubic pain. Suprapubic bladder pain, which is experienced when bladder is full and is relieved by micturition. I'm going to study this again. Disease processes in the bladder. Disease processes in the bladder, example: infection or inflammation, can produce suprapubic pain. Suprapubic bladder pain, which is experienced when the bladder is full and is relieved by micturition, and is typical of interstitial cystitis, an idiopathic benign inflammatory disorder of the bladder typically seen in middle-aged female. So if there is suprapubic pain, if the female comes with the suprapubic pain, okay, suprapubic pain which is relieved by which is relieved on micturations, and the woman is about middle age, then it is to be suspect. So the disease to be suspected is interstitial cystitis. Cystitis is inflammation of a urinary bladder. So the term cystitis is given for the infection of urinary bladder. So let's suppose this is a urinary bladder. Okay. So we talk about interstitial cystitis. So up now we talk about pain, different type of pains. We talk about dysuриas, Here we talk about dysureas and other causes of the body mutilation. Those are urinary bladder cancers and carcinoma in situ of the bladder. And we also talk about difference between renal pain and the uterine colic, and we also talk about the colic pain and the renal pain. Other than the stone, okay. So, and we talk about the interstitial cystitis. What type of pain? We also talk about the pain in case of interstitial cystitis. So let's look at the testicular pain. Testicular pain is common symptoms in men, especially in early middle-aged. Okay, sudden severe testicular pain in younger men, less than 40 years old, should be treated as a sudden severe testicular pain in younger men, especially under the 40 years old, should be treated as a medical emergency. Okay, and the patient assessed so that the diagnosis of acute testicular torsion can be excluded. So acute testicular torsion is very painful, and if the person under the age 40 years old comes with a testicular pain, then they should be admitted in emergency. The time interval from the onset of a pain to diagnosis of the suspected testicular torsion should not be influenced whether scrotal exploration is performed. The time interval from the onset of the pain to the diagnosis of suspected testicular torsion should not be influenced whether the scrotal exploration is performed, as torsion detorsion may be occurring and the testis may still be salvageable after a delayed time interval. I don't get this term. The time interval from the onset of the pain to diagnosis of suspected testicular torsion should not influence whether scrotal exploration is performed as scrotal exploration is performed as torsion / detorsion may be occurring. May be occurring and the testis may still be salvageable after delayed time interval. Oh my god, I'm not getting this. Okay, chat, if you know it, please help me out right here. Yeah. So 1 lakh and I will study 1 hour extra. Okay. The time interval from the onset of the pain to diagnosis of suspected testicular torsion should not be influenced whether the scrotal exploration is performed, as torsion detorsion may be occurring and the testis may still be salvageable after delayed time interval. Hydrocele and epididymal cysts usually do not cause significant pain. Okay, if the patient comes with hydrocele or any kind of epididymal cyst, it is not that painful but can have an increasing pressure effect as they enlarge. Okay, but hydrocele and epididymal. So what are the other things that? So talking about the testis, the various causes that causes no. So various cause that causes the pain of the testis is testicular torsion. So testicular torsion is an emergency condition. So if the patient is less than 40 years old, and should be assessed immediately. And there are other conditions for the testicular pain as well. The other condition for the testicular pains are hydrocele and epididymal cyst, and these are not that severe, but it might cause pain when they enlarge. So hydrocele and epididymal cyst are other factors that causes significant increase of the testis that might cause the pain. Okay, specified as the illness. Okay, the dragging sensation is in the scrotum, which get worse toward the end of the day, is typical of the discomfort associated with the varicocele. Scrotum. Dragging sensation of the scrotum, which gets worse towards the end of the day, is typical of the discomfort associated with the varicocele, often on the left side. Typical testicular tumors in young males are not associated with a significant pain. So the testicular tumor, so other diseases that can occur to the testicular tumors, and testicular tumors are not that painful, especially in case of a younger child, younger adult male or middle-aged male. Is okay. Investigation of testicular pain in the young adult male / middle-aged male is frequently negative, resulting in a highly unsatisfactory diagnostic level of idiopathic testicular pain, which is subsequently managed with the input of other clinicians, most commonly pain management specialists. Okay, so the surgery, so the surgeon do not have any role in that case. In case of idiopathic testicular pain, so in that, usually in that conditions, the diagnostic apparatus might not be that good, because it is probably in the initial phase. It would be shown in case of older phase. So in older cases, but in that particular cases, it is not that prominent. Therefore, it is not diagnosed, I would say. So the doctor will term it as an idiopathic testicular pain, even though we should not leave. We should not neglect it, since it is basically a testicular tumor. So counseling should be given to the patient, and in that case, surgery should not be performed. However, the patient should be advised to go to the pain management specialist. Okay, patients undergoing vasectomy are routinely considered for the approximate 10% risk of testicular pain in the short term following surgery, but more importantly, 1% chance of chronic testicular pain in the longer term. So if the patient comes, okay, so what are the diseases that we talked in this testicular that causes testicular pain? So number one was testicular torsion. It is very important to note that below the 40 years of age, testicular torsion is an emergency condition. So the other factor that causes testicular pain were hydrocele and epididymal cyst, and other causes that causes testicular pain was varicocele, and other was testicular tumors, but testicular tumors in youngs, and generally an adult or middle-aged man is not assessed by diagnostic tools. Therefore, it is often labeled as idiopathic testicular pain. Therefore, pain management specialist is used in that conditions. And one of the most important causes of testicular pain might be vasectomy, because it is performed by many men. So in that condition, about 10% of people have or experience any cases of testicular pain in short terms following surgery, but more importantly, 1% chance of chronic testicular pain in long term. Okay. So perineal pain. Okay, perineal pain, not perineal pain. So we'll be starting perineal pain after this summary box. Let's look at the summary box. Renal pain is not synonymous with renal colic. Okay, there's a difference between renal colic and the renal pain. Renal colic basically means uterine colic. Renal colic is a misnomer and should be referred to as uterine colic. Okay, I was talking about this. Renal pain can be distinguished from uterine colic by careful history tracking. Okay, so the pain section of the history tracking should be assessed very properly in order to distinguish renal pain and the colic pain. Renal pain and the uterine colic may be experienced simultaneously. It can be experienced simultaneously. Uterine colic may be radiated to the groin test. Okay, radiation is very important in order to assess if the pain is renal pain or uterine colic. Uterine colic often radiate to the groin and testicles, groin testicles or labium in case of female. And it doesn't radiate to the back of the leg. Uterine colic doesn't radiate to the chest or back of the leg. Okay, which means renal pain might might radiate. This means renal pain might radiate. So let's talk about perianal pain. Is often feature of complex symptoms typical in the middle-aged men who, by a process of exclusion, are diagnosed by suffering from acute or chronic prostatitis. Which with prostatitis, perineal pain may be accompanied by suprapubic pain, low back pain which radiates to the legs, penile pain, as well as frequency of micturition and dysuria. Perineal pain is an ominous symptom after previous treatment for a pelvic malignancy, often signifying a recurrent pelvic disease. Lower urine tract infection symptoms. Okay. So this is an important topic. Lower urine tract symptoms are the so we talk about one of the objectives, two objectives basically. So the only thing remaining is to understand the difference of the common lower urine tract symptoms. Okay. So we understand pain relating to urinary tract infection. There are basically two types of pains: renal pain and the utericolic pain. Utericolic pain. Okay, utericolic. So we know how to differentiate between the utericolic pain and renal pain, and we also understood the difference between the renal pain and that's the same thing. And we also studied about significance of pain relating to urinary pathology, because and different type of pain that might occur to different organs. For example, a renal pain causes the renal pain, causes the utericolic. We talked, and we also talked about the causes of body micturations other than the low urinary tract infections. And this is also a better example. Testicular pain. We also talk about testicular pain. That's all. So let's talk about the lower urinary tract infections or symptoms. Okay. So the International Continence Society provides an internationally accepted definition for symptoms relating to the lower urinary tract functions. Oh, wow. Internationally accepted definition for symptoms relating to the lower. Okay, there's differences. Okay, there are. Oh my God, there's a lot of terms. I wouldn't say wow, but oh my God. Frequency. Okay, frequency. So according to definition, there are various terms given, and I think we need to study all those terms. So let's start with the frequency. Okay, frequency is the complaint by the patient who considers he or she voids too often during the day. The patient may report needing to void more frequently than is their usual habit, or for more frequently than they consider socially acceptable. So we also talk about there's something called as nocturia as well. Is the complaint that the individual needs to wake at night at least once to void. Okay, this increased frequency. There is a nocturia. There is stangury. So I didn't know this term. So let's see what it is. The sensation of constantly needing to void. Okay, incomplete passing of urine. Typically, the patient describes having to stand/sit for long period with the chances of that micturation is imminent. Okay, once the person goes for the micturations, the patient stays in the bathroom for the long time, as they have that feeling that their urine is not yet complete. So that term is called strangury. Okay. Urgency is sudden compelling desire to pass urine which is difficult to defer. Sudden compelling desire to pass urine which is difficult to defer. Okay, there's frequency, there's nocturia, there's strangury. Okay, I need to know how to pronounce this term, so I'm going to Google for that. I would let you guys hear that as well. Just a minute. Okay, you could hear, but the sound would be very small. I couldn't make it loud. So we are going to source the pronunciation of stangury or whatever it is. Okay. So how to pronounce strangury or whatever it is? Let's see.
Strangury.
Okay, it is strangury.
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 Strangury. Okay. This is the definition from Oxford Language. So a condition caused by blockage or irritation at the base of the bladder, resulting in severe pain and strong desire to urinate. Strangury. Strangury. Okay, so I know new term today. It is strangury. 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 Okay. Strangury. Strangury. Wow. So strangury is one thing. Another term was urgency. So urgency is sudden compelling desire to pass urine, which is difficult to defer. This also called as urge incontinence. What is is an involuntary urinary leakage? Okay, of a large volume immediately preceded by the sensation of urgency. Urgency and episode of urge incontinence. Sudden compelling. Okay, urgency is sudden compelling desire to urinate, and urge incontinence is leaking of the urine from the urine bladder after the urgency. Basic in a simple language, leaking of the urine after the urgency is urge incontinence. Okay, urinary incontinence is basically inability to control the urinary out urinary pee in a simple way, in a very simple language. Incontinence means unable to control the void of the urine. So urge incontinence means the incontinence that occurs after the urgency is urge incontinence in a exact term. So there is also something called as stress incontinence, as we are seeing right here. Stress incontinence. Let me make this full. Okay, now it's good. Is an involuntary urine leakage which occurs when the intra-abdominal pressure rises. This most common in this stress incontinence is involuntary urine leakage which occurs when the intra-abdominal pressure. Whenever the intra-abdominal pressure rises, there is a stress incontinence. Okay, this is most common in females who have had vaginal deliveries, who describe small volume urine leakage associated with activities such as coughing. Okay, so what are the causes of the increasing intra-urine pressure? The one is coughing. The other is laughing. Okay, sneezing or exercising. Basically, four causes that causes increasing intra-abdominal pressures that would cause a stress incontinence. So, what are the causes of stress incontinence? I'm just not seeing PDF right now. My eyes are closed, so I'm going to guess or assume. So what are the causes of the stress incontinence? The causes of the stress incontinence are urinary urgency. Is it? Nope. What the fuck are you talking, man? It's coughing, sneezing. Coughing increases the intra-abdominal pressure. The other factor that increases intra-abdominal pressure is sneezing. The other factor that causes that increases laughing. Laughing is one of the other factor that causes increase in intra-abdominal pressure, and exercises. And I would say that even in case of pregnancies, there's increase in intra-abdominal pressure due to enlarged uterus. So in that condition, also stress incontinence is increased. However, however, it is different. So stress incontinence is often seen in case of women who have just gone vaginal delivery. So nocturnal enuresis is involuntary loss of urine during sleep. Involuntary loss of urine. Nocturnal enuresis is a nocturnal incontinence, basically. Loss of urine during sleep. A common cause in an elderly male is chronic retention of urine with overflow of incontinence. Okay, hesitancy is the term used when an individual describes difficulty in initiating the menstruation, resulting in delay in the onset of the voiding after the individual is ready to pass the urine. This can be several seconds to several minutes and often symptoms of the bladder obstruction. So reduced urinary stream is usually reported. Okay, oh my god, there's a lot of topic. Strangely. So we're almost up to the half, but let's revise this. So we're talking about the frequency. Frequency is increased number of micturations, and then we go to the term called as nocturia, which means having a lot of at night, a lot of urge to urinate at night, and there's something called as strangury. And strangury is basically, what was strangury? Senses of constantly, okay. Strangury is after the micturations of the urination, and there is incomplete void. There's a feeling, there is certain feeling that the urine is incompletely passing, not satisfaction of urinary passing, since constantly needing to void, basically senses of constantly, okay. So there is something also called as urgency. Urgency is acute or sudden desire to urinate is urgency. And urgency incontinence means uh, incontinence that comes after the urgency, or leaking of the urine from the leaking of the urine after an urgency is urgency incontinence. There is something called as nocturnal enuresis, which means passing of the urine at night on bed, and this also called as stress incontinence. And in stress incontinence, we need to remember the. So we need to remember that stress incontinence is mostly common in case of female, especially the female who have undergone vaginal delivery, and especially in case of activities that leads to increasing intra-abdominal pressure. And the activities that increases the intra-abdominal pressures uh, are coughing, laughing, sneezing, and some exercises. And these are something also called as stress incontinence. Nocturnal enuresis. So involuntary loss of urine during sleep. A common cause of elderly male is chronic retention of urine. Okay. Let's talk hesitancy. Is the term used when the individual describes difficulty in initiating. Okay. Hesitancy is difficulty in initiating the urination. It's called hesitancy. And reduced urine stream is something. Reduced urine stream. What does that mean? Reduced amount is reported. So let's talk about the reduced urine stream. It is usually reported compared to with previous performance, or in comparison with the performance of others. This is often seen with bladder artery obstructions. Intermittency is the term used to when the individual describes urine flow which stops and starts on one or more occasions during micturition. Straining is the muscular effort used in order to initiate the straining. Muscular effort in order to initiate to maintain or improve the urinary stream. Incomplete emptying is the sensation that at the level of the micturition bladder fullness persists. Post-micturition dribble is a term used when an individual describes involuntary loss of shit. Are classified as either storage frequency, okay, avoiding lots. In general terms, lots are classified as either storage lots, okay, voiding lots, post-micturational lots, storage lots. Storage lots result from failure of bladder to act as a functioning reservoir for urine and are commonly seen in patients with an overactive bladder or bladder neuropathy. Okay, voiding and post-micturational lower urinary tract symptoms are commonly seen in males with the bladder outlet obstructions. Boo. So how many types of lots are there? There are 3 types of lots, and basically there is something called as storage lots, which is seen in case of neurogenic urinary defects, and there is also something called as voiding. Is it? Yeah, voiding lower urinary tract infections, and post-micturational urinary tract infections. Post-micturation lots. Voiding and post-micturational urinary tract lots are common in case of males with the bladder obstructions, bladder outlet obstructions. Boo. Okay. So voiding and the post-micturational lower urinary tract symptoms are most commonly in case of obstruction of the outlet of the urine bladder, and however the storage lower urinary tract symptoms are most common in case of neurogenic urinary bladder pathology. pathology. So okay. So the male with the bladder might also have bladder outlet obstruction, may also have storage lots, as a thickened detrusor muscle resulting from outlet obstruction becomes overactive, resulting in the combination of symptoms. The term prostatism is now obsolete. The lots are frequently investigated with urodynamics. Summary box 75. Okay. Lower urinary tract symptoms. Lots are classified as storage, voiding, or post-micturational storage. Okay, it can classify in three types: storage, voiding, and post-micturational. We all studied about this. Storage lots are frequency, nocturnia, urgency, and urge incontinence. Okay, I think these are important things which I didn't study well. So there is frequency. Okay, this nocturia. Okay, urgency and urge incontinence in case of storage. In case of storage loss are typical of an overactive bladder. Okay, overactive bladder. Voiding loss are hesitancy. Okay, voiding loss are hesitancy, reduced stream, and straining. So what is straining? Straining the muscular effort used in order to initiate, maintain, and improve the urinary stream. Okay, straining means okay. Some people make noises while urinating, so they are actually straining. In that condition, they are straining. So straining in case of seen in case of voiding incontinence. It can be asked in MCQs. This is important. Hesitancy and reduced stream. Hesitancy means difficulty in starting the micturition, and reduced stream means is usually reported compared with previous performance or in comparison with the performance of others. This is often symptoms of bladder outlet obstructions. Okay, dribbling of the urine from the urinary bladder while urinations is reduced stream. So voiding lower urinary tract symptoms are hesitancy, reduced stream, and straining. Some patients may have storage and voiding lots in combinations, are often investigated with urodynamic. If you guys could see, okay, you can see that it is almost 10:06. So what is the time that I've been studying? It's almost 34 minutes. Okay. I was planning to take a break. Hematuria occurs when there is blood in the urine. This occurs with visual hematuria and non-visual hematuria. Okay. What we refer as macroscopic or frank or gross hematuria and macroscopic. Okay, always remember we refer to as macroscopic or frank or gross hematuria and macroscopic of okay. Visible, non-visual. Okay. Visible, non-visual, but also we used macroscopic and microscopic term. Okay. Yeah, inquiry should be made out of the timing of the body in relation to the urinary stream. Initial pathology to the stream. Strain. Frequency, nocturia, urgency, and urgency incontinence is seen in case of storage lots, and in case of voiding lots there is a. I'm just closing my eye and trying to revise. In case of closing, okay, in case of voiding lots there is this straining is obviously there, and there is some important. There's more. Okay, dribbling of the urine, which means dribbling of the urine. Oh, there is hesitancy as well. This at first, number one, there is hesitancy. Number two, there is urinary incontinence. Is it? No. Reduced stream, straining. Okay. hesitancy, reduce stream and strain. I got that right. Straining, I also got that right. That is hesitancy, but reduce strain. Okay, there's didn't get that. It's okay. You don't get everything. Hematuria can be two types. The one in which blood is seen and the one in which blood is not seen. To be made out of timing of the blood in relation to the urine stream. Sorry, you guys could hear my voice. I was just checking if my voice is good or not, but I just found out that it's too low. I need to do something, and the thing that I'm doing is taking my mic and keeping it near to my. Oh, guys. So, guys, our time is up, and now I'm going to take 5 minutes break. I'll see you guys after that. So we are taking 5 minutes break. Okay, so guys, I'm back. Okay, and there's going to be trouble. So I'm going to study about for 15 minutes. Just a minute. Hello? I think you guys could hear some noise at the background. The noise is like that. And it's annoying, for me too. I don't know how and when it comes when I start charging my device. But that's annoying. I don't like it. But we'll study anyway. Okay. So I'll speak loud so that you guys could hear. And just ignore the background noise because, okay, I should have charged my laptop. So we already finished all those topics. We also talk about LUTS and type of LUTS. Let's go brief on type of LUTS. It was storage. It was storage, which was when associated with the pathology of a neurological pathology of urinary bladder. Then there is something called as voiding, and there is something called as post-menstruational LUTS or lower urinary tract symptoms. So in case of storage LUTS, there is something called as it includes it includes urgency. Is it? Urgency and urgency incontinence. It also includes frequency, and it also includes nocturia. Okay, nocturia, frequency, nocturia, urgency, and urgency incontinence. And voiding includes hesitancy, reduced stream and straining. Hesitancy, reduced stream and straining. Hesitancy, reduced stream and so storage LUTS includes frequency, nocturia, urgency and urgency incontinence, and voiding includes hesitancy, decreased stream, and straining. Hesitancy, reduced stream, decreased stream or reduced stream, and straining includes frequency, nocturia. Okay, talk. So this. So let's study about the boxes because we already studied about important topics, objectives. And so nowadays is classified as visible hematuria or non-visible hematuria. Okay, list of potential cause for hematuria can be rapidly generated by considering trauma, infections, neoplasm at all levels of the urinary tract from kidney to the urethra. Potential cause of hematuria can be rapidly generated by considering trauma, infections, trauma, infection, and neoplasm. Hematuria is investigated with a renal USS and flexible cytoscopy with a renal USS ultrasound. I don't know USS. What does USS mean? And a flexible cytoscopy as a minimum. Okay, let's go through this topic just very fast. Hematuria occurs when this blood in the urine this is now classified as visible hematuria or non-visible hematuria. Older terminology referred to microscopic hematuria and microscopic hematuria. Inquiry should be made out about timing of blood in relation to the urinary stream, initial urethral pathology throughout the stream Okay, you can listen in urine stream. Okay, initial is most commonly seen in case of urethral pathology. Throughout the stream is most commonly seen in case of bladder or upper tracts, or terminal is especially seen in case of bladder neck or prostatic pathology, as well as degree of hematuria and its frequency. So it is important to note if the blood is in case of urinary is seen initially, then it is most probably a urethral cause. If it is seen in case in throughout the urination, it is the most probable causes of urinary bladder. And if it is transitional, is it? Yeah, terminal means at the ending, then it is most probably the bladder neck or prostatic pathology. Okay, this okay. And if the blood in the urine is seen at first, the cause is urethral cause. Okay, urethral cause. If it is seen throughout the urination, there is probably the urine bladder cause or before bladder. And seen at the terminal, probably the neck of the urinary bladder or the prostatic cause, urinary bladder cause or prostatic cause. Okay, the concern of the urologist is that hematuria, especially if the venous is due to an underlying neoplasm of the urinary tract. Usually a bladder or renal tumor. Causes of hematuria is include trauma, infections, and neoplasm. Think of teen. Okay, at all the levels of urinary tract, hematuria is in association with a loin pain and palpable loin mass palpable loin mass defines the classic triad of symptoms and signs of a renal tumor. Although the triad is seen less than 10% of the patients presenting with a renal tumor. Apart from young females with a proven urinary tract infection, most patients with hematuria, whether visible or non-visible, will be investigated urgently as hematuria clinic where they will have renal ultrasound scan and a flexible cystoscopy as a minimum. The cancer detection rate depends on the degree of hematuria, being approximately 20% in those patients with a visible hematuria, but very much lower in those with non-visible hematuria. Okay. Discoloration of the urine. Main drugs and foodstuffs have been reported to produce abnormal discoloration of the urine. Most colors have been reported, but the most frequent encounter clinically are red, orange, or brown. Clearly, hematuria is the commonest cause for the red urine. However, the presence of heme in the urine is also produces red discoloration and generates a positive dipstick test. So if there is any presence of hemoglobin in the urine, there is a positive red dipstick test. Red urine discoloration is due to hemoglobinuria, may present in the hemolytic disorders such as march hematuria, classically seen in dehydrated soldiers after prolonged marching. Okay, so the prolonged marching might cause redness of the urine. It is called march hematuria. Likewise, the myoglobinuria is due to the myocyte destructions. Because myoglobinuria is due to the myocyte destructions. Example caused by the rhabdomyolysis after cross injury. Rhabdomyolysis after cross injury can cause resulting discoloration of the urine. Okay, disorder. Severe modification can cause red or orange discoloration of the urine. Most commonly, rifampicin. So the red. Okay, so it is rifampicin and isoniazid. Rifampicin RI rifampicin causes tears and out of body fluids, generates discolored. Okay, others includes chlorpromazine, thickened thiouredazone, senna, and laxative containing phenolphthalein component. Consumption of large quantities of beetroot can result in tear discoloration of urine as well. Beetroot. This discoloration is due to the excretion of a beta-cyanin. Pigments such as betanin. There is beetroot betanin. Okay, from beetroot there comes betanin. The most commonly used antibiotic nitrofurantoin and metronidazole can lead to the urine being discolored brown. Brown urine is due to the high circulating bilirubin. Is also a feature of obstructive jaundice. So, in case of discoloration of the urine, there are the most common cause is redness of the urine, which is seen in case of in case of excessive hemoglobin in urine, and the excessive hemoglobin in urine is seen in case of hemolytic disorders such as MASH disorders, and MASH disorder is seen in case of people in case of army who have been marching a long day uh, without having any drinks. And there is something, and the other common causes of discoloration of urine is drugs, and the drugs such as rifampicin and isoniazid, which I remember by IR blaster, no, sorry, IR isoniazid and rifampicin might color the urine orange, and it also colors other body fluids orange. Okay, and the other important cause that causes discoloration of urine is urinary is a beetroot, and the main component that causes red urine in case of excessive consumption of beetroot is uh, bit, betanin. Is it betanin? Betanin. I just remember betanin, but betalin. It is betalin. Betalin. It is betalin. Let's come on unit symptoms are hepatospermia. Okay, what does that mean? Refers to the blood which can be bright red or hematocrit color seen in the seminal fluid. Okay, that is creepy. Pneumaturia, this is air common gas in the urine. Okay, patient typically describe frothy urine, bubbles. Okay, that is funny. Damn it, bubbles in the urine stream which intermittently stops then starts again. The commonest cause in underlying colovesical fistula usually due to the commonest cause is an underlying colovesical fistula. Okay, it is fistula in between colon and the vesicle. It might cause pneumaturia, which means the patient explains that the urine is frothy, fizzy, usually due to the primary pathology in the rectum and sigmoid colon. Okay, so there's something called urethral syndrome. In this condition, typically seen in young females, symptoms suggestive of urinary tract infections are reported, but with negative bacteriology. It is sometimes remedied by simple cystoscopy and urethral dilations. Symptoms related to the external genitalia. Testes. We always talk about testes. The pain testes have, the torsions, and other causes of that testes might have other important causes that testes might have are hydrocele, varicocele, and other important cause of the pain is vasectomy in case of male. About 10% of patients might have post-surgical pain. It's may be absent from the scrotum in patient with undescended or ectopic testis. In boys less than 5 years, common cause of testicular pain swelling is torted hydrated or Morgani. Appendix testis. What the hell? Hydrated of Morgani. Torted hydrated of Morgani. Often in young males, the scrotal skin is transparent enough to allow visualization of small blue swelling at the superior pole of the testis. In young males suspected of having testicular torsion, examination of normal, that is contralateral testis, may reveal a horizontal lie or cleft bell testis. These are the very important. Patients with canfield syndromes typically have bilaterally small film testis in addition to the other signs typical of these conditions. Between the testis and the tunica vaginalis, and the younger male can be associated with a patient with possessive vaginalis. On opening into the hydrocele, the fluid is typically yellowish in color. Testis which cannot be felt in a tense hydrocele in the age groups at risk of testis cancer needs to be assessed by USS prospectively. Okay, investigation of urinary symptoms. Okay, we're talking about blood test. Blood test in patient with potentially blood test in a patient with potentially serious urinary tract pathology often starts with screening blood tests such as full blood count, urea and electrolytes, anemia, accompanied by diagnosis of urinary tract malignancy in an adverse prognostic feature of renal cell carcinoma. Serum biochemistry. Modern assessment of a biochemical renal function not only involves reporting of serum levels of urea, creatinine, and electrolytes, but in addition involves reporting of the estimated glomerular filtration rate. Okay, creatinine is an endpoint of muscle catabolism and suffers from the disadvantage that EGFR can be wide ranging from a given serum creatinine level. For example, serum creatinine level of 1.5 mg per deciliter may correspond to the EGFR from approximately 20 to 90. EGFR is nowadays recommended as an optimal method of reporting renal function in many countries. The modification of diet in renal disease study equation use age, gender, race, and standard serum creatinine to estimate the GFR. I'm sorry. When the patient with a urological cancer are being considered for nephrotoxic cisplatin-based systemic chemotherapy, in general terms, the EGR needs to be 50 milliliter per minute or greater. Patients with a calculus disease routinely have serum calcium and uric acid level checked to rule out the metabolic predispositions to surgery. Summary box. Okay, we're talking about summary box. Biochemical assessment of renal function. Okay, EGFR is increasingly reported along with the urea and creatinine as it is more informative due to renal function test. EGFR. Okay, with both kidneys functioning normally, an individual has approximately 6 times the renal function needed to remain off the dialysis. Very good. The serum creatinine will remain normally with unilateral renal pathology, but normal functioning contralateral kidney remain normal with unilateral renal pathology. But okay. Tumor markers. Serum tumor markers are utilized in patients with a prostate and testicle cancer. Okay. Tumor markers. So EGF with glomerular filtration rate, creatinine test, and urea test are important for demonstrating the functionality of a kidney. So other screening blood test. What we check in blood? We check urea and electrolytes. Anemia is accompanied by diagnosis of urinary tract malignancies. Adverse prognostic features. Okay, that's important. Okay, prostate specific antigen is very important, and it is important in case of prostate cancer. Is it? Prostate is glycoprotein produced by the prostatic epithelial cells. It is responsible for liquefaction of seminal fluids and allows spermatozoa to swim freely. As a consequence of altered architecture of the prostate in conditions such as benign prostatic hyperplasia, okay, and prostatitis as well as prostate cancers, PSA enters the bloodstream and is so what the function of PSA? prostate specific antigen is to help sperm to swim. Yes, in prostate specific antigen is for swimming of what? Swimming of sperm, which is water. So PSA helps sperm to swim in the uterine fluid, I guess. Okay, this can be significantly altered by urinary tract infections. After an infective episode takes 6 weeks to return to baseline values. Is artificially lower in men taking 5 alpha reductase inhibitors, finasteride and dutasteride. Okay. Midstream specimen of urine. It is very important and we have been studying it very long ago. Midstream specimen of urine is used to establish the diagnosis of a urinary tract infection and primarily allows identification of the irresponsible urinary pathogens and selection of the most appropriate antibiotic. Most will be processed in two stages with the initial microscopy followed by urine culture, and one is the appropriate. Normally, urine contains small numbers of white blood cells and epithelial cells as indicated. Resolution is 0 to 40. Okay, 0 to 55. 0 to 40 10 to the power 6 per liter. Okay. Early morning samples are sent 3 consecutive days for Gill-Nielsen staining in culture for acid-fast bacteria. If genital urinary tuberculosis is suspected, and early morning urine is performed, just similar to the early morning sputum of scent in case of tuberculosis of lungs. In case of tuberculosis of genital urinary tract, early morning urine should be performed for Gill-Nielsen staining for acid-fast bacilli. Voided urine cytology is performed. Voided urine cytology is performed when a urinary tract malignancy, usually is suspected. Uroepithelial carcinoma is suspected. Sorry. Endoscopy. Okay. Cystoscopy. This is cystoscope. Okay. Enlarged detection of gallbladder tumor using narrow band imaging. Oh my god, there are a lot of it. MRI, we're not going to study now. This is bone scan. I've done this for myself actually. Super scan with intense stitching. What the hell is this count? Bone scan. I've done bone scan. Got a shit. Didn't get a shit when they did bone scan to me. Okay. The bone scan is most frequently used in patients with urological malignancy when other imaging suggests there may be a bone metastasis present. It is also used in routine staging of patients with high risk prostate cancer, although there is a 5% chance of bone scan being positive until PSA is. The technique radiopharmaceutical used in renal imaging to evaluate the renal structure, especially in the pediatric population where there is used to detect the renal scanning. Okay, we finish this chapter. We didn't need to go through this topic. We just been to the basic topic. I'll be studying this, but we almost got 3 of the objectives. Okay, so beta function. This seems important. Simple is follow flow rate and US residual urine estimations. Urodynamics provides a pressure flow profile. Urodynamics, okay, this is the urodynamics about the bladder pressures and the urine flow, okay. Bladder pressure and the urine flow. The device for urodynamic assessment is shown in figure 75.35. Okay, this one is more the device urodynamic pressure. So during urodynamic, fine catheters are inserted through the urethra into the bladder and to allow the bladder feeding and to record the intravenous pressure. The test is commonly performed to investigate the male patient with LUTS, low urine tract symptoms, and female with loss or incontinence. It is also commonly used in those patients with the suspected bladder neuropathy. 2 phases of the test is test of feeding phase, during which the fluid installed into bladder concentrate, and voiding phase. Patient asked to avoid the involuntarization. Feeding phase. Okay, high. Okay. This one was urodynamics. Urodynamics, and there's a machine. This one is urodynamic, and they separate machine for the investigation of a urodynamic. It's given this figure. What is done is that a patient is inserted catheter in their urinary bladder from outside. Then it is filled completely with the fluid, and then the patient is said to void the urine. In that case, and the pressure and the flow rate is measured by the device that is out there. Okay, so we will be studying this, and then we will stop after studying this. But let's see how much longer it is. Is it? Okay, not that easy. It's not that easy. Seems interesting, although I've seen this picture. Sorry. This one is long. This chapter is long, damn. Oh my god, I'm so sleepy. So guys, 5 minutes break. I'll be back in 5 minutes.